Welcome to Medical News in Schools this afternoon. We've got a variety of speakers on the subject of asthma. We have Peter Broughton, Children and Young Persons Project Manager for Suffolk North East Essex programme. He supports the asthma programme and the rollout of the National Bundle of Care. So he'll be talking to us first. Then we have Dr. Sarah Nethercote. She's a paediatrician with an interest in asthma and lung disease in children and is working currently at West Suffolk Hospital. We also have with us Dr. Mashbileg, who is otherwise known as MASH. She's a consultant lead for health protection and now leading the Asthma Friendly Schools programme. And joining us hopefully for any questions and answers at the end is Dr. Lakshman, a paediatric consultant at West Suffolk Hospital. So over to you, Peter.
Lovely, thank you, Kate, and thank you all for joining us this afternoon. So as mentioned, I'm Peter Broughton. I work for the part of the NHS. I work for the Integrated Care Board, which supports our integrated care system. I'm just giving you a brief introduction of the programme. So just a bit around about asthma, just to set the scene really. So the UK has one of the highest prevalences of asthma in the world. Mortality rates for asthma are higher in the UK than in many European countries. Looking at the National Review of Asthma Deaths, it found 14% of deaths were in the under 19 age group, and care fell well below that expected in half of these. In response to this and a couple of unfortunate deaths for young people in recent years due to asthma, the National Bundle of Care for Children and Young People was released by NHS England in September 2021. NHS England worked with key stakeholders, including young people, their families, and other professionals to develop this bundle. The bundle aims to support local systems with the management of asthma care in children and young people. The programme offers a large number of resources to support local regions such as ourselves, also a small financial envelope, regular network meetings to share ways of working, and several deliverables looking to help improve asthma provision. If we look at our area specifically, so we all work with different areas in Suffolk, but we cover the Suffolk and we're part of the Suffolk and North East Essex care system. There are just over 1 million adults and children registered here with their GPs across the system. We have just under 8,000 young people reported in the area on System 1 as having an asthma diagnosis. With that said, the figure is likely higher as not all practices in Suffolk use System 1. They use another system called EMIS, and North East Essex is even less for the System 1 usage. We've done a bit of data collection on ED admissions from April 2021 to, I should say March, apologies, 2022. There were over 100 asthma-related emergency admissions to our 2 Suffolk acute hospitals, and this was in children and young people, so those in 18 and under. Deprivation, poor management of the condition, and air pollution are three of the main aggravating factors that affect young people who have a diagnosis with asthma. Just giving a bit of a brief about what we've done in our own area. So since the bundle of care was released last year, we've set up a SNE clinical asthma network. This involves a variety of colleagues across the system, including colleagues from schools, colleagues from primary care, secondary care, and our community colleagues as well. We've also recruited a dedicated ICS asthma lead, Dr. Raman Lakshman, who's also on this call, who began his position in June. Our programme focuses on training, education on asthma, as well as bringing together colleagues and system partners to build up a joined-up approach. We're looking to map asthma provision to identify any gaps and bring system partners together. This mapping has also been backed up by data we've obtained on CYP admissions, the number of CYP diagnoses, and similar data we've been able to find so far. The SNE Asthma Network is working to link up primary, secondary and tertiary sectors of our healthcare system. We have also obtained licenses for the MySpira augmented reality app. This is planned to initially be rolled out by primary care and has been shared with school colleagues to get them familiar with the format and promotion of its use. There is also licenses for this app that should be released within the next month or so. There's just some background work that's just to finalise the release of that. I've mentioned that. Sorry, that's a correction on the first part. We also have a asthma-friendly schools policy, which MASH is working on and have more details on, and we have a target for 25% of schools to achieve an asthma-friendly status. There's also an under 12 and over 12 guidance to use in healthcare settings that has been released and shared across the system. Also, sorry to mention, the schools have an asthma policy and list of pupils with long-term conditions, including asthma. And there's also been training from Health Education England, which has been rolled out. And we strongly encourage that all school staff those come into contact with young people with an asthma diagnosis complete tier 1 of this. The link's in this slide, and I can share it after the presentation as well. That's all for me in terms of an introduction, so I'll hand over to my colleague, Sarah.
Hi, so my name's Sarah. I'm one of the paediatricians with special interest in respiratory and allergy medicine in West Suffolk. So I believe this is the first talk in a series that we're going to be doing on asthma and how we can help improve care in the community, particularly in schools. So I know people on this call will have different backgrounds, knowledge of asthma, so please forgive me if it's a little bit too simplified at times. A very basic overview, as this is the first talk. So asthma, it's a chronic respiratory condition associated with airway inflammation and hyperresponsiveness, and as we all know, it has long-term management but also has acute attacks or exacerbations. Because it's a long-term problem, people, children, teenagers and adults all get a bit bored of it, and particularly in the teenage years we end up seeing some poor adherence to the medications and the management that we can provide. So as a medical profession, what we can do is we can provide education to families and communities. We can prescribe daily medicine, daily preventer medicine, although we can't ensure people actually take it. And we try and aim to provide medication so that people need their rescue medication, so which is often a blue inhaler, not always, but their rescue or reliever medicine once a week or less. Well-controlled asthma is much less likely to exacerbate or progress onto an acute attack. In schools, the concerns are firstly in an emergency when children become acutely unwell with breathlessness, with wheeze, needing treatment or needing ambulances to get to more medical help. But overall, children are unable to reach their potential due to their asthma, either in the sports field or academically, and there can be a significant amount of time missed from school. So when we talk about asthma, we need to think about, in schools we're mostly thinking about the acute attacks, and so it's important to be aware of triggers. It's really important to know that generally children with well-controlled asthma are very unlikely to be completely well and suddenly become extremely unwell if they're exposed to their trigger, whether that is a virus, whether that's pollen, temperature change. Generally, there's some underlying poor management, or it will be a combination of triggers, such as a child who's got a cold and then goes swimming or goes out into the cold air, and these two things together will lead to them becoming a bit more unwell than they would otherwise have been. Better controlled underlying asthma is always less likely to exacerbate, and that's why we go on about it so much. So sport and asthma, so which is the title of this talk. So there's a lot of commonly misheld beliefs about children with asthma. So the first is, often we hear that children with wheeze shouldn't do exercise. Children with asthma shouldn't be pushed until they become breathless, or that when children with asthma become breathless, this is an asthma attack. None of these are true, essentially. So remaining physically fit and active is really, really important for children with any respiratory condition, whether it's asthma or something else. And being physically fit will help children to control their asthma, and also to be able to cope with it. Being unfit will make things worse. So the only reason not to exercise is if they're currently having what would colloquially be called an asthma attack. The other important thing to remember is that not all wheeze, not all breathlessness, not all cough is asthma. So a child who has asthma but doesn't like running, who becomes very breathless, doesn't necessarily need to stop. It could just be cardiovascular fitness. The other important thing to remember, which doesn't have a good slide, is that a lot of children become slightly addicted to their blue inhalers. And will often use it excessively. Yeah. And then just a few hints and tips. When you have children with asthma in front of you, it is always tricky. It is always going to be a little bit more worrying. But all parents should have wheeze action plans or asthma action plans. And these should always be given to the school at the beginning of the school year, and when they and whenever it changes. And it's really important that children always have access to their reliever medication. So if they're going to sports, it shouldn't be left locked in a cupboard somewhere. It should be with them, whether they're in the swimming pool, on the tennis courts, or wherever they're going. And also, if they need a spacer, which we will come back to, they will also need to take their spacer with them as well. So, as I said, every child should have a plan, and this should include when they need to take their reliever and what to do with it. If you don't have it, or if you know a child is particularly sensitive to exercise, then there are some general tips you can give. You can give the blue reliever inhaler prior to the warm-up. So 2 puffs of salbutamol will generally be enough. And this is for children who do get exercise-induced asthma. A more gradual warm-up can be used for these children, and allowing rest time and the blue reliever inhaler as required. It's also really important that parents are aware if their children are becoming breathless with or having asthma exacerbations. They can then take this on to the medical professionals, who might need to either look into their adherence, are they actually taking their preventers, or maybe even step up their preventer inhaler. Oh, I've gone backwards. Apologies. So just another little thing about spacers and devices. A lot of children, a lot of adults have asthma and have medication, but they don't necessarily use it correctly. One of the really, really important things that we drum on about the whole time is that medication is only good when it gets to the correct place. So in our case, inhalers are only useful if you can get the medication into the lungs. So there's lots and lots of different types, but the aerosol type always needs a spacer. So if a child has an aerosol type inhaler, they should always be using their spacer. Without a spacer, even the best technique in the world, you can only get 20% of the medicine to the lungs. And generally people don't have good techniques, so it's kind of 0 to 4%. With a spacer, it's still only about 40% or so, but it's much, much better. If we with a spacer, we get more medication to the lungs, which means that you're having less medication in the body, so less side effects, and it's less bad for the environment. Blue inhalers are actually one of the worst things in the environment within primary care. About 15% of the carbon footprint from primary care is on blue inhalers. So using them correctly is really helpful. If children are older than 12, they can have different types of inhalers which don't need spacers. but they just need to be able to use their device correctly. If you feel that they're not using it correctly, again, please highlight it to the parents so that they can either go through it with the child or come to see us and we can help. Another just hints and tips is whenever a child uses an inhaler, please inform the parents in the same way that you would if they'd had an injury that needed any attention. Very often in clinic we have parents come in unaware that their children are using their inhaler 2 to 3 times a week, and it just allows parents and professionals to have a more clear idea of how well their asthma is being controlled. And we've talked about wheeze plans and possibly using relievers before activity. And then again, always consider the location of the activity and whether, and kind of tailor making medicine. So children who have hay fever are much more likely to exacerbate if you're running around a field in the summer. And so it's just to be kind of more aware of each child's needs and their triggers. So a slightly rambly talk, but in summary, exercise is very good for individuals with asthma, and done safely and correctly. It was really, really helpful. And tailoring medical management to enable each child to reach their potential will improve everything to do with asthma in children. Lovely. And so there are some really useful resources out there, which again I will send on. And then I believe next we have Mash.
Thank you, Sarah. So I'm just going to upload my screen. Hopefully it's going to show you. Okay. Can you see my screen? You can see my screen, yeah? Lovely.
I can see your screen.
Yeah,
yeah, thank you.
Can you now? You can, yeah. All right. Okay. Lovely. So,
Nash, if you wanted to just start the slideshow, then we'll see the slides a bit bigger.
All right. Okay. Lovely.
That's just on the top menu.
Is it better?
Perfect.
Lovely. All right. Okay. Good afternoon, all. So I'm Dr. Mash Medrak. I'm a lead consultant for Children and People Services and for Health Protection, and I work at Suffolk County Council. So what I'm going to talk next few minutes is about the air quality and the impact of that on our health, and focusing very much on asthma. So as we know, the public health, what we do, we very much look into data, we look into the evidence, what really works well, what we can do about it. So I'm just going to show you a couple of slides now. So this I borrowed from Health Matters. So this shows very much the conditions, the health conditions associated with exposure to nitrogen dioxide, so the air pollutants. As many of you know, that the good quality air is really important for us, and it has this huge impact on our health. But if the quality of air is poor, it can really have a negative impact and can cause some health problems and issues and worsen the existing condition that we have. Although it's very difficult to attribute the incidence of asthma on other diseases due to poor air quality, it's quite difficult because there are so many confounding factors that need to be taken into the people's lifestyle. Where do they live? And what do they do, so-called wider terms of health, and also the way how we measure air quality and monitor is quite difficult. But UK health security agencies, they found really strong evidence that poor air quality can really have a negative impact on our health. As you can see on the screen, I show you that it's a cumulative incidence cases attributable to nitrogen dioxide. It's in England by disease and total between 2017 and 2035. As you can see, all the diseases are listed here, as you can see, and also the evidence, whether it's the evidence is weak or strong, is shown on bicolored. So you can see asthma has there's a very strong evidence that poor air quality can have an impact. Those who have asthma, it can cause asthma as well. So the next one is very much PM2.5. This is again another form of air pollution, and it is called particulate matter. It is a term used to describe a mixture of solid and liquid particles suspended in the air for longer durations. And it does come of quite a different variety of sources. So again, actually lots of research has been done. As you can see, it is again cumulative incidence, cases attributable to particulate matter in England, and by diseases, as you can see, there's a really strong evidence on CHD, coronary heart disease, and stroke, and other asthma, as you can see, and the lung cancer. So whereas the others there's quite weaker evidence. So the scale of the problem, if you look at the scale of the problem, that there is an estimated long-term exposure to man-made air pollution in the UK, has a huge impact. It does cause a really large number of deaths. It's between 28,000 to 36,000 deaths in the UK. And as it also, there is a huge research is done in a way that actually the per cubic meter, this is again the unit of measurement for concentration of gaseous pollutant in the air. So over the following 18 years, 1 milligram per cubic meter reduction in fine particles of air pollution in England could prevent, you could see the really large number of cases of coronary heart disease and strokes, and also causes of asthma and the lung cancers. So it does show that there is a really strong evidence that the air pollution can cause asthma, can lead to death, the premature death. So many of you also probably know that the Ella Deborah in 2013, she 9-year-old girl died of asthma, and there was an inquest in 2020 concluded that the very first time that air pollution was ruled as a cause of death. So you probably have seen this, and this is a really good example of how our children and why they should be really protected, and therefore we should be really looking at the evidence, what we can do about it. So this is again, I'll leave that with you for, and the coroner has concluded that the air pollution was the significant contributing factor for both the induction and the exacerbation of her asthma. So this is the first time it has been really evidenced, and nitrogen dioxide was actually recognized as a failure to, that we had failed to reduce the level of nitrogen dioxide to within the EU limit and domestic law. So again, actually, this is the history made, and after this, the air pollution, air quality, and how we can really monitor those the air pollutants. As you can see, this particular you can see the specific the pollutants there. So what's happening in Suffolk, that we do have air quality management areas in all our districts. As you can see, this one is very much the map in areas of Ipswich. Those, as you can see in the boxes, and blue, the line there, they're colored in blue, these are air quality management areas in Ipswich. But overall, if you look at the air quality in the whole of Suffolk, we're not very bad. But there are spots around the county, and also especially in a bigger towns like in Ipswich. So, and the levels of pollutions are above the recommended limits. Therefore, there is a really good the monitoring system in our district councils have, and they are responsible monitoring and introducing interventions to reduce the levels of air pollution. However, certain areas, it's quite tricky, as depending on the location and also depending on the hours, the traffic and the weather, and transport routes. There are so many confounding factors that can really influence the air quality in Suffolk and also in the bigger towns. So air quality action plans, each district, they produce annual air quality action plan. And one of them is very much anti-idling campaign. And also it does introduce the enforcement regime. And also what we are trying to do, our district councils, is that campaigning to raise awareness of the air quality in areas nearby schools, to influence the behaviour change of the parents and the carers who bring in their children into the school area. You've probably seen many of them are, you've seen many of them actually bringing their children and just wait, and just car is on, they don't really switch off their cars, isn't it? So therefore there's a huge campaigns going on, and I have looked at the annual reports which really submitted to our Director of Public Health, and we have such a good monitoring system on that. So again, actually, what we are asking is very much all drivers switch off their cars when they drop off or pick up their children, and also quite a lot to work with young people young people that our districts are doing. So again, actually, young people are quite receptive, and they can be really challenging their parents and the brothers sisters who are picking them up. And also we have looked at the kind of reimagining the streets and the different active travel and give you green infrastructure, different projects there. So making sure that actually clean air, how important to raise awareness of how important is the clean air. So the key messages. So we need to do, again, as schools need to be really asking, do you know whether your school is in air quality management area? So if so, what does this mean? Do you have a link with those who are doing the anti-idling campaigns, the district colleagues, the health and wellbeing officers and the planning officers involved very much in it? Are you promoting active travel? So what is active travel? So need to be really important to look into that. And also look at look into the air quality alerts, because there's a really good alerts, pollution alerts notifications comes from DEFRA. So again, actually, to protecting our vulnerable children is very important on that. And there's really good lessons that the resources our air quality leads at district level have. It will be really important if our teachers and the heads of schools can be in touch with them and work with them. There's lots of good quality resources around there. And also understanding what is the local action plans, because our schools have our children there 8-9 hours a day. So therefore, the children coming to school, living school, and being around the school, playing, it's really important for them to have the clean air. So therefore, it's quite important. It really matters. So therefore, schools can play a really important role, challenging and making the drivers and also the district council to be accountable for the clean air. So this is about in terms of the air quality. So another thing, what I would like to give another message is that, as Peter mentioned, within Asthma, Children and People Asthma Bundle. So we are very much campaigning, like to support and work with our schools that to make them all asthma-friendly schools. So what does that mean is that there's a really clear 5 standards that all schools should be really achieving. I wouldn't say it's very easy, but I don't think it's very challenging. So it's again, actually, all schools should be having asthma policy. It doesn't mean that they have a policy there, but it's really practical asthma policy, making sure each school has own asthma policy, what to do when the child has having the asthma attack and things like that. Also, another thing is that actually making sure the schools, the teachers should be aware that those children who have asthma should have own asthma care plan. And all staff must be trained in care of children with asthma. There's a tier 1, tier 2 training. It's that all of them are free. It's not very long training, 10-15 minutes at all, but there's really good quality resources there. And also emergency inhalers is really important when asthma attack happens. So all schools should really have now an emergency inhaler. And also this is actually in addition to sometimes children have their own inhaler, sometimes they may not have it. So therefore it's quite important. And schools, all schools should really know the children who have the health conditions, and especially the asthma. So making sure there is a register of children. So these are the 5 standards. And once the schools achieve those 5 standards, they can easily audit themselves on the website. I just provided their asthma management education settings in the Suffolk Learning website that you all use. It's there, really good, the web page we have created. So you can just go and audit yourself and get your status. So why we want all our schools to be asthma friendly? Because it helps reduce absence from school and improve attainment. We all know many children with the long-term health conditions, especially asthma, they have a really poor attendance. Therefore, it can have a negative impact in their attainment and also future opportunities that they can really have. And also, if children are managing their asthma well, they can sleep well, they can improve the concentration, so is the attainment. And also it can help the children increase their participation in activities, the social activities or the physical activities outside of the home. And also it can reduce the stigma, because every single child who has the long-term health conditions have a stigma, isn't it? Yeah, so therefore it will be really helpful. So there are some links there, so I'll stop here. So thank you very much for your attention. So over to you now, to Lakshman.
We can't hear you, Dr. Lakshman, sorry.
Okay, I just wanted to say thank you very much to Mash and to Sarah and Peter for their presentations. And I think all I want to say, unless there are any questions, is to say that in health, one of the great things we can do is to work closely with education, because obviously children and young people spend a lot of their time in schools, and I think we do not have good interfaces between health and education. And I think the asthma, if this is an area where we can work together on asthma, and that can be a model for other conditions as well. So thank you to all the speakers and to Kate, and I don't know if there are any questions. Otherwise, thank you.
So does anyone have any questions? I just have a couple of points, actually. I think that teachers will want to know, and school staff will want to know, how to access the Tier 1 and the Tier 2 training. Peter, are you able to tell us that?
Yeah, there's links that I'll share with you, Kate, and I'll share them in the chat, but it's a link to, I think it's they call it ELFI, which is normally we use for some of our e-learning anyway. But there's national links. They're from Health Education England, so it's a national piece of work. I can share the links with you afterwards, if that's okay.
Lovely. If you can put that in the chat bar as well, Peter, and then perhaps people will have access if they're watching the recording. And the other question, you mentioned, Mash, a web page that you've created. Your slide was very quick at the end there. I don't know if you've put the link to that web page, or if it's possible to perhaps put that in the chat bar as well.
Yes, lovely. Yeah, I'll do that, Kate. So this is very much Suffolk Learning. That's the web page, the website. Our schools, all school staff and leaders, they access. There's all resources that schools need in all areas of education, including health. So we're working very much our health and safety officer Nina Bickerton, and we've created asthma management web page in our health section. So have a look at it. So we put all the standards that I mentioned for the asthma friendly schools standards, and the links, and what are the requirements there, and audit all free resources out there. So I put the popped in the link to the website, Kate, in the chat. Thank you.
Many thanks, Mash. Okay, well, thank you very much for your time this afternoon. I know that it took a while to pull all of you together and find a time that was convenient for everyone, and there's been lots of emailing going backwards and forwards on this, but I'm sure that our Suffolk schools will really appreciate this, and I know many of them will catch up on recording. So thank you very much for your time today, and any questions that do come through from Suffolk teachers, if you would like to direct them to any of our colleagues here, I'm sure they will be happy to help you. And I can also give your my email address, the medical needs in schools one. Please do get in touch with me if you feel that you would like to be in touch with anybody else. Okay, so without further ado, I will thank you again for your time, and well, hope to see you soon.
Thank you, Kate.
Thank you very much. Thank you.
Thank you, Laura. Thank you.